Welcome to the PharmaVOICE 100 one-on-one video series with Karen Groen.
Jeff, thank you for joining us for our one-on-one conversations for the Celebration Marathon.
Absolutely. Thanks for having me. I'm really happy to be here.
It's our pleasure. Jeff, let's talk about your vision, what you see coming as the next frontier of health engagement.
Sure. So, when we think about health engagement, I would have to say, honestly, one of the things that COVID-19's proven is that any perspective on the next frontier of health engagement really only lasts up to the moment that there's a new thing that causes a significant shift in people's behavior. So, I think honestly, right now we're in the middle of that shift, both from a patient and physician perspective. And quite honestly, it's gone on long enough that some of those behaviors will become adopted as the new norm. So, people are changing their approach to managing their own care. And so in order to engage with them, we also need to change our approach along with them. I don't think there's anyone who really will challenge the fact that telehealth's emerged as a critical means of physician-patient communication. And it's these kinds of technologies, I think, that we need to look at before they actually hit critical mass and help develop the engagement strategy alongside the technology providers. So, fortunately, from our perspective within McCann, we've identified telehealth as the next wave in point of care about a year ago. So we were able to really position ourselves well with our clients and companies in order to be ready for that kind of wave that hit. I would say, additionally on the patient side, unfortunately, the current political climate has created an environment where people are really afraid to trust literally anything that they read. And so I think, we need to utilize all the vast emerging data points in order to better understand how the patient is going to resonate and relate to things from an emotional and behavioral perspective, so that we can make sure that we're connecting with them and delivering information that's critical to their care and that they're digesting it effectively. You want me to, because I have some thoughts about HCPs, which is a little different from the patient side, if that's relevant for you too. I would look at, from an HCP perspective, it's really become important to be as prescriptive as possible when engaging with them. They've significantly less time on their hands, and they're less likely to accept people in their offices. So, one of the ways that we've been able to address this is we've debuted a new tool called Resonance, and that basically what we're doing is we're layering multiple data points together about physician behavior and learning preferences, so that we can engage with them when we know that they're individually treating patients from a testing, diagnostic, or administration perspective. And so that way, we're identifying communications that are going to be really relevant to them literally when they need it, not necessarily just, when we're trying to reach them on our own terms.
Sure. And those are great thoughts. And I love that aspect of the telehealth and where we're going to go in the future. And I think that we're going to see a lot more of that, as statistics and surveys are showing right now. But talk to me about what your secret sauce is to combining science, creative, and strategy to meet patients' needs as part of this new engagement collective, if you will.
Yeah, sure. And to be honest with you, that's one of the reasons I decided to join McCann Health as a larger healthcare ecosystem. There was a point in time when it made a lot of sense for some of these things to be separated and siloed, particularly in the media side, because, when you had media and creative separated, it was really for economic reasons in order to get the best price leveraging from a media buy across multiple accounts. But today, with the number of different channels that are available and with the data that's accessible based upon how people engage with media, it makes so much more sense to bring all that to the forefront of the strategic process, as opposed to looking at it primarily as a determination of success of a campaign, because the data helps drive success, because that way you have a much greater understanding of the patient as an individual from a quantitative perspective. So when you're bringing the science, creative strategy, and media together, it makes a much more collaborative environment, because when they sit in silos, they each have their own priorities and interests. And it makes it really, really difficult to successfully collaborate in order to create that success that you need for the client and the best system of care for the patient. So when we look at having centers of excellence that share best practices and resources, and you're able to integrate members of those centers of excellence into the working brand team, you're always able to provide best resources for the client and share resource allocation and ultimately improve the patient experience in the most effective way. So, we've seen that when you pull all of those things together, from a media perspective, as an example, into all of the different elements, we have a significant impact on differentiating the ways that we approach our process across the entire spectrum of communications, regardless of whether it's medcoms, managed markets, or commercialization. Because now you're seeing things that you wouldn't have otherwise seen, because you never had those layers of information previous to this integration in order to be able to differentiate and really make a difference for the client.
Jeff, thank you so much for sharing where you think your vision for the future and how important this is for the patients. So thanks for being part of our one-on-one conversation.
Absolutely. Well, thanks for having me, and it's been a pleasure, and I'm always happy to have a chat with you, Taryn.
Thanks.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.